Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Hello, everyone, and welcome to the special edition of This Just In Radio. I'm your host, Justin Barnes. Today, we're broadcasting live from ViVE2026 in sunny LA. Very excited to be here. It's already been an action-packed 36 hours since I landed. The prominence of this specific show grows every year, and I feel very fortunate to be able to broadcast annually from this event. Rich Scarfo and the entire health team are extremely supportive, and I'm tremendously grateful. I also want to make a special note of thanks to Roberta Mullen and Jake Reed for their support in helping me produce these ViVE broadcasts and recordings each year. They are terrific. This is actually my 12th year broadcasting live from a healthcare industry conference, and they helped make it my best year yet. So grateful for them and certainly my amazing guests. For today, though, I have a fantastic lineup of CEOs, CIOs, care providers, innovators, policy leaders, and visionary. If you miss any of this broadcast, all my shows are from This Just In Radio are posted at Amazon Music, YouTube, Spotify, Pandora, Apple Podcasts, iHeartRadio, SoundCloud, Spreaker, and the TuneIn platforms. As many of you know, my goal for broadcasting live each year from these key conferences is to create an information medium that shares best practices, strategies, and actionable intelligence from the industry's leading sources and experts. My goal, along with all my guests here, will be to offer tactics and strategies not only to survive, but to thrive as you navigate your hospital, your physician practice, your company, or even your family through all of these changes occurring across healthcare. There is more opportunity than ever before for all of us to thrive, but we must understand how healthcare is evolving, how policy and reimbursement is shifting, and where best practices and innovation can support our efforts. I hope you glean all of that over the next few days. That's at least my goal. Welcome back to This Just In Radio Show, broadcasting live from ViVE2026 in sunny LA. Very excited to introduce my next guest and great friend of the show, Dr. Nick Patel, CEO, founder of Stealth Consulting. Welcome back to the show, my friend.
Great to be here.
Fantastic. So, how long have you been in town?
Got in late last night, and I have to make some changes in my flight because can't go back to New York right now.
No. Is that where you live full time?
No, I had a meeting there, so that got canceled. So now, luckily,
you're in South Carolina, aren't you?
I'm in South Carolina.
Yeah.
Yeah.
Columbia.
Yeah.
Right, yeah.
Yeah. Rare that we get snow, but we actually got snow this year.
Yeah.
Yeah. So it's beautiful, but luckily for us, it didn't freeze over and it went away in 24 hours.
No, this was tough. I mean, just having you on the show earlier, and tough people coming from the East Coast, but thankfully, I think most of the people that at least I've been meeting with and on panels have been, they're here, and thankfully they got here. They came in for the storm, or they're finding a way to make their way here.
Exactly.
So, what are you most excited about seeing in the industry today?
Well, you know what, I'm really excited. I think we're at this precipice of a major change in healthcare. Where we're starting to see optimized EHRs. We're now looking into AI agents and automation to really help with the workflow efficiency. And if you look back, even since the HITECH Act, there hasn't been a lot of change when it comes to overall fundamental change in how we do business in healthcare. But we're about to see a major change in how patients interact, how providers see their patients, how operationally we set up our organization, how we partner, and obviously, as you've seen, the payer system continuously changes and challenges us, and so we really have to be on top of this. But I think the biggest catalyst, honestly, is that we're finally seeing a major change in leadership. We're starting to see the next generational C-suite come in now that is now going to look at this more progressive, more open-minded, out-of-box thinkers. Yeah. I'm not to say anything was wrong with the traditional people that we had, great folks, but it's a different time now.
Another person's in your seat just a moment ago, Chris Patel from Northeast Georgia, CIO, extremely progressive, moving a system forward, wants to be the dominant player in the area. I mean, that kind of, just that confidence and the strategy and the ability, and it's just cool to see.
Absolutely.
And those, I totally agree, those people are absolutely rising up.
Yeah. Well, the population continues to grow. Access is still a major choke point for everyone. Right. Even your own health system providers, your own team members have struggles to get seen by their own health system. That should tell you a lot. And, we have to do something about this whole issue with access. Otherwise, we're going to still have the broken system of people going to the ED for things that could have been avoidable. Yeah.
When I asked Chris, and I'll ask you the same thing, but I said, what are you most passionate about that you're currently working on? He said, you know what, it's probably not sound not too passionate, but my ambulatory strategy. We're going to retreat next week, talking about the ambulatory strategy. I'm like, I personally love that.
Yes.
I love the 90+% of care is provided in the ambulatory setting.
Yep.
And I mean, that's what we as consumers usually see when we come across them. That's what we need.
Yep.
So I love it. But I'll ask you the same question. I know you're like mine in that regard, but what are you working on that you're most passionate about personally?
Yeah, so I work with a few health systems as a fractional executive and work on a few things. One, ambulatory strategy is actually top of mind for many, many of those folks. And where the challenge, though, is that you have to have a clear strategy that's not only operational, but also clinical. So that's one, and I can dive a little deeper into that. But the other thing is how do we actually bring joy back into work life? Right. That I would say is also because we're losing providers. Workforce shortage is a real thing, and we're losing nursing. We're losing providers. There's, I believe, they said 80,000 doctors in shortage by 2030 for primary care alone. So if you got third parties hiring physicians, you have nurses hiring, third parties hiring, there's only a few to go around. It's not like you can turn a spigot and turn nurses and doctors out overnight. Right. And so, you know, that's one of the things that I'm really working on is the synchronization between how do we keep our workforce happy and retain them and make them happy and keep them here, but also how do we actually grow our ambulatory stance, which is one of the biggest challenges we have, primary care.
So yeah, I've actually never quite asked you what you do because my show's all about thought leadership and strategy, but tell me about self-consulting real quick.
Yeah, I appreciate that. So I was with Prisma Health for over 2 decades, various leadership roles. I'm a physician, practiced as a hospitalist and primary care physician over 2 decades. I was CMIO and eventually became the Chief Digital Officer. I left there almost after 22 years, and I have my own company called Stealth Consulting. And I love the organization. I just wanted to do something different. And so now I get to talk to other health systems around the country around strategy, and then work with health tech companies, various health tech companies, and also private equity. I'm an operating partner at Concord Health Partners that has multiple health system LPs and a lot of health health tech companies that we invest in that are really trying to move the needle in behavioral health and telehealth and payment reform and other things like that. So it's really nice being able to have a meeting with a health system, then a company who is Series B or C, looking at growth phase and helping with thought leadership and commercialization, and then talking about investors on thesis of where we should be investing our money, where the M&A needs to happen, and et cetera. So that's my day.
No, I know our worlds cross in lots of different ways, and that's kind of how my world is set up. I have my radio show, my thought leadership, and I help build software companies, but then also I do my radio show, and then I also do advisement to companies on go-to-market with health systems primarily, but a lot of also ambulatory practices as well. And so it's kind of it's compartmentalized, and I love the fact that we never have a boring day. We solve lots of problems for lots of different people, lots of different verticals, and it keeps us going. But I know we have a lot of worlds in common.
Yeah, well, we're making impact, and at the end of the day is what we want. I think a lot of times, sometimes when you get in a rigor or work in one place, you kind of spinning your wheels, but we're actually moving forward, you know, building those tracks.
You got it.
Yep.
What are your goals for ViVE 2026 this year?
A lot of my clients are here. Some of my health system clients are here, really to make those connections, have them sit down and talk about their problems and understand how this company or this health system may need their efforts, their solution, but also to open up the minds of some of the health system executives on what the realm of possibility are. When it comes to ambient, when it comes to agentic AI, when it comes to all these new nice shiny objects that are out there. You know, how do we focus attention so we actually are strategic in what we choose, and we're clinically focused, most importantly, to solve a true clinical need.
What are your goals for ViVE 2026 here in LA right now?
Yeah, one of the things meeting a lot with my clients, both on the health tech side, but also with my health system clients. With my health system executives, mostly work with C-suites. They're here to learn about new technologies, but also make those connections with companies that will help them both operationally and meet their clinical needs. And so I'm here to connect the dots between and try to remove the noise between who you should be looking at least from a thematic perspective, and then have the health system go through the RFI, RFP process on the selection side. But at least to get to see what's the realm of possibility. But it's also not only looking at what's in the future, but what can we get rid of? What do we clean out of the garage and consolidate so we don't need to add 20 different tools anymore because the technology has advanced so much. That's one. The second piece is really to make connections, meet people, listen and learn from others. I think that's one thing that we don't do enough is we tell, but we don't listen. And we all...
And also thought leaders, it's really important for us because we do a lot of talking. It's really important for us to continue to always do listening.
Absolutely. And we learn from each other. I learned a lot from you. I learned from our friend Rasu and others that you're interviewing. And that's what it's about. At the end, all of us at one point in our lives are going to need access to healthcare, and we're all working towards what kind of experience that will be for us.
Absolutely. So final question, it'll be a tough one.
Yep.
Looking at the proverbial crystal ball, what do you think is a strategy or trend that we need to be ready to navigate in 2-3 years from now?
I think the biggest thing is we need to stop thinking as unified, like instead of individual health systems and practices, to one of a unified health system and have systemness and integration. And it seems like everyone should be doing that and everyone knows that, but it's very poorly executed or rarely seen. One of the things that we are seeing a major trend is setting up air traffic control for health systems. So imagine a 20 health system organization. Well, all those health systems within there, and they don't always communicate real time. You don't know throughput. You know what's going on in census data. And so having an air traffic control, a true command center that actually has both the connection of different personas that are looking at, hey, there's a high-risk patient in room 5. Let's get care coordination involved. Let's get pharmacy involved virtually into the room, right? And then let's call the family in virtually through a link and have a secure conversation. Let's bring the hospitalists in. And having a true air traffic control, just like you traveled here, right? What happens? We're going to take the seatbelt sign off right now. It's going to be a smooth ride. But hey, guys, we're going to meet some turbulence in about an hour. I'm going to turn it back on. Why do they know that? Right. They know that because there's 5 planes that went in that same path before them, and they report that back. We don't get that sort of level of real-time alert and insights in a health system. And having an air traffic control, I've talked to multiple health systems that are looking into this now. I think you're going to start to see more of that sort of air traffic towers across the country that are helping navigate people and health systems, both internally and externally, get the care they need.
I love it. I can see how that would tremendously benefit a community right out of the gate.
Yeah, I hope so. That's the hope anyway. I do think this Rural Health Transformation Fund is going to be a real good lifeline to help navigate some of that and those investments. But again, I hope that it's being used for meaningful things and not pie in the sky things. Because this community hospital, I'm really concerned of the number of hospitals that have high risk of closure.
Very good point. Dr. Nick Patel, I appreciate your time, my friend.
Absolutely. Thank you for having me, guys. Justin. Appreciate it.